The opening here is the external nair, and that opens into this little cavity called the vestibule, and from the vestibule we open up into the entire nasal cavity. External nair, vestibule, nasal cavity. Inside the nasal cavity you have the concha superior, middle inferior, and depressions between them. These are the meatuses, superior, middle, and inferior. And it ends back here, this region, which is called the internal nair. External nair, internal nair, and the opening to the eustachian tube. That leads to the pharynxes, which is the back of the nose, throat, and upper larynx. And this region back here is the nasopharynx. Find the nose, come all the way back as far as you can go, nasopharynx. The oropharynx, the opening to the mouth, all the way back over the tongue to the back is the oropharynx. And down here, the larynx, above it, is the hypopharynx, or laryngopharynx, three regions of the back of the throat: nasopharynx, oropharynx, laryngopharynx. You have the tonsils. These are the pharyngeal tonsils here. You have the palatin. There's one here. There's one on the other side. This is just half a view. And the linguinal tonsils. Pharyngeal, palatin, linguinal. And then you have the oral cavity with the hard palate, soft palate, uvula. And then you have the esophagus, which sits behind the trachea. This is the trachea, the airway. And here you can see the false vocal cords, this short ridge here. You have this true vocal cord, which comes out further to the middle of the airway, and the vestibular folds between them. So when you look at this true vocal cord leading to the trachea, that's called the glottis. The opening is called the glottis. So I have this trachea, this larynx, hyoid bone, thyroid cartilage, tracheal cartilage. As you look through here, see the opening, guys? I see the opening and I see you. That is the glottis, the rhemoglottis, open. True vocal cord, false vocal cord, vestibular fold here. Same thing here. False vocal cord, vestibular fold, true vocal cord to the trachea. So, heading down the trachea, which you can see a portion of it here. I'm going to remove these two areas of the lung. So you can see the trachea, and here's the trachea descending. The carina splits the bottom of the trachea into the left primary bronchus, right primary bronchus, and this left primary bronchus splits again to become the secondary bronchuses. The secondary splits again to become the tertiary, primary, secondary, tertiary bronchuses. The outer layer of the lung. The outer layer of the lung is called the visceral layer, and that area that sits beneath the sternum and the cartilage is called the costal surface. You have the bottom of the lung, which is called the base. The flat bottom part is called the base. The top pointed part is called the apex. And then exposing the area where the heart would be, which is called the mediastinum. This depression here, where both ventricles meet, is called the cardiac notch. But the inside layer is called the mediastinal surface. Mediastinal surface, cardiac notch. This is the hilum on either side, which is where the blood vessels enter and exit. You can see the pulmonary vein, pulmonary artery. This is the hilum. And then you can also see the root of the lung. That's where the extrapulmonic airway meets the intrapulmonic airway. Extrapulmonic is outside the lung proper. Inside is inside the lung proper. Down here you have the principal muscle of respiration, the diaphragm. And that takes care of that. Now, between the pharynx and the trachea is the larynx. You have your hyoid bone, thyroid cartilage, cricoid cartilage, and these individual tracheal cartilages. This is the thyroid gland. Then we have membrane, thyrohyoid membrane, cricoid cartilage, cricothyroid membrane, cricotracheal ligament, and then each of these are tracheal ligaments. So the first membrane is named after the thyroid cartilage, thyrohyoid. This is the hyoid bone. Doesn't articulate with any other bones in the body. And then you have the cricoid cartilage, where we name two ligaments, cricothyroid ligament, cricotracheal ligament. Posteriorly, you can see the cricoid cartilage. These are the arytenoids. These are the triangular-shaped cartilages posteriorly and superiorly to the cricoid with a little hook or beak called the corniculate. Okay? And there you have it.